And so, Dr. Phelps, if you want to go ahead and begin and introduce yourself, and we'll go through a few remarks from people on the line, and then we'll open it up for Q&A for the reporters on the line.
Welcome, everyone. My name is Dr. Thomason Phelps. I am a retired family physician from Tullahoma, Tennessee, a lifelong Tennessean, and I am one of 2,000 Tennessee physicians who joined Dr. Aaron Millstone in challenging our governor, Governor Lee, to stop ignoring health experts in managing the COVID-19 health crisis. I took an oath to protect my patients. And right now, the greatest threat to their lives is the contradictory and sometimes false statements being shared about the COVID-19 pan-epidemic. And the failure of some political leaders to listen to health experts and focus on addressing this health crisis. Governor Bill Lee ignored doctors and began rushing to reopen businesses in Tennessee on April the 27th, without a very careful plan to contain the virus and protect our workers. And that has allowed things to get much worse. And now there are more than 430 Tennesseans who have died. And presently, there are more than 9,000 active COVID-19 cases in Tennessee. Now, we've had some qualified success, but instead of using the time bought by that success to prepare and address the health crisis by increasing contact tracing and testing so that we can break the chain of transmission when it's discovered, Governor Lee rushed to reopen without taking a more cautious approach to protect our economy and our lives. Today, I am honored to be joined by Dr. Susan Andrews and Dr. Amy Evans. They're two of my colleagues in Middle Tennessee. First, we'll hear from Dr. Susan Andrews with family practice partners from Murfreesboro. Susan, your remarks, please.
Hey, some of my patients call me Dr. Seuss, but anyway, I've been in practice in Murfreesboro for 39 years now, and have been taking care of some of the same patients for that long. And, you know, I became a doctor because, number one, I love science, I love patients, and it was baked into my DNA that I want to help people. That was a family thing. And I took the same oath that you did, Dr. Phelps, to protect my patients. And initially it was really disturbing to me to be aware of what was going to happen with the coronavirus from the time that they diagnosed a patient up in Washington State, 5 miles from where my son lives. I knew what was coming, and it was distressing to see that after it got here, it took so long for us to jump on it. Fortunately, Governor Lee jumped on it, and he finally did, and it made a difference. We saw the rate of people going into the hospital and getting sick from the virus go down. When he stopped it, I knew what was coming. We just weren't to the point where epidemiologists recommended that we could open up our state. And I knew that it was going to take 2 to 3 weeks for us to be able to see the consequences of that, and now we're living with it. I personally have acquaintances, patients who've had the coronavirus, and one has died, and it's really distressing. There are not any shortcuts. We really need to listen to the scientists, the epidemiologists. Washington State had a huge uptick initially, but they dropped it really low, and now they're at an R value of 0.6, and they're are gradually reopening. But they are listening to the epidemiologists, and that saved countless lives. You know, I hate to see what's happening now. We're seeing that we almost have 2,000 hospitalizations now. We are getting positive cases of as much as 486 since June 1st a day. And you know, this is not all due to increased testing. We had a huge uptick in testing when it first became widely available, but people have really backed off from that now. So I think these are real numbers. I want the economy to reopen and life to return to normal. I haven't gotten a check for 3 months. I'm blessed. My kids are grown. My daughter, it's a little harder on her. She's a doctor and she needs her check, you know, but we can't go back to life as usual at this point unless we want to see a lot more people die. And you know, to think that you can open an economy and it's going to go back to normal when there are enough people who are still cautious and being careful that they're not going back to work. We need our leaders to help us beat this. We need leadership. We need to have a transparent and cautious approach, Governor Lee. This isn't a time where libertarian values can rule the situation. We are all connected, every single one of us. There have been, 600 nurses who've died from the coronavirus. When people don't take care of themselves, or when they have to go back to work because their choice is either their health or their money, because their job is there, you know, that's a false choice. You know, we've seen that social distancing works, mask works. We've also seen that recommendations do not work. You know, I call restaurants before I take out and I say, are you using masks or not? And one will say, no, we're not. And I'm like, okay, bye. You know, there are stores I choose where I will take my rare trip into a store by whether or not they require their staff to wear masks. Most of them don't. It's, you know, recommendations do not work. They didn't work before, they're not working now. We need to have leadership to save lives. I felt a bit hopeless about this because you see it coming, you know what's happening, and I felt a bit helpless. I hope that maybe just doing this one little thing might make a difference. I hope that Governor Lee will listen. I know that he cares about people, and I know that it was hard for him to go against his values and make the decision that he made initially to cut down, you know, to do safe at home. But I'm begging for him to help us out again.
Well, thank you, Dr. Andrews. I appreciate your remarks. Next, we will hear.
One last
thing.
thing.
Go ahead.
I'm sorry.
Right.
I just celebrated because I got some masks. So some definite things that we need is we need access to good personal protective equipment, like masks. I can't buy wipes, even though as a healthcare facility, I'm supposed to be able to get them. We need that. We need regular routine testing with quick results. We need good contact tracing so that we can see when we find a case, we can track them down. But, you know, we need help. We're not ready. We're not ready to open back up. And I'm glad that some people realize it and are taking care of themselves, but there are a whole bunch of people that aren't, and we need some leadership.
Thank you, Dr. Andrews. Andrews, I appreciate all that you had to say. Our unreadiness is systemic, and I think you know that, and so many people do know that. And the roots of that unreadiness need to be uncovered, but that is the subject for another show. Next, we have Amy Evans, Dr. Amy Evans, a pediatrician in Sewanee, Tennessee. And I'd like to hear your remarks regarding our younger Americans who are threatened by this pandemic.
Well, thank you, Dr. Phelps, and I agree wholeheartedly with you and Dr. Andrews and what you've been saying, and thank you for allowing me to participate. So I'm Amy Evans. I'm a pediatrician. I've been in practice for 26 years at Sewanee Pediatrics. I founded the practice. I own and manage the practice, and I went into pediatrics because I'm well suited to speak for those who have no voice. And children have no voice in our society. And I'm really a believer in prevention. An ounce of, you know the old adage, an ounce of prevention is worth a pound of cure. And that really applies to the coronavirus pandemic as well. So what I've been seeing, I've been sending tests. I probably haven't seen anybody with coronavirus. I've known of people who've had it, but probably not seen yet. And I'm a pragmatist, I say yet. I've sent tests and it's taken anywhere from 4 to 8 days. I'm hearing that now the turnaround is faster, but a test that takes 8 days to come back is not a useful test. So we are not anywhere near to having appropriate, reliable, rapid tests for the widespread availability of testing. I'm seeing confused families because they're getting mixed messages, and even within families there's challenges. You know, one family member doesn't want to sign up for Little League she's getting pressure from other family members, and we're getting mixed messages from our leaders, from our political leaders, and I don't know if they don't have the ability or humility to listen to the public health experts and infectious disease experts and follow their recommendations, but they're putting us at risk. I don't see that it's an either or. Protecting our public health is also protecting our economy. Back to the prevention. We can lower the number of infections. We will be able to open in a safe way. The USA can do anything we put our mind to it. I agree with Dr. Phelps. We're behind the 8 ball. Public health has been underfunded for decades. Primary care has been an afterthought, but we're ramping up and we'll get there, but we're not there yet. So until we have rapid testing where we can get the results within 24 hours, even earlier is that my daughter-in-law is German. She works as a doctor in Germany. She's been tested twice and she's gotten the results within 12 hours. Until we have contact tracing where we do have the staffing to investigate any contacts and isolation, we're not gonna be able to prevent a surge of these infections. It's not a fight, it's winning. We only have defensive strategies. So physical, I heard someone say, we have to stay 6 feet away so we don't have to bury someone 6 feet under. So we only have physical distancing, we only have masks, we only have hand washing and taking good care of ourselves, getting good night's rest, eating healthy. I mean, that matters too. So we only have that. We don't have any way of truly fighting this yet. So I'm an optimist too, but we're not there yet. We need our political leaders to give us consistent messaging so people aren't confused and we are consistent in our practices. This is the way we show we care for each other now. We stay apart, we don't give hugs. So I would, I guess I would add PPE, the protective personal equipment you've all heard about, includes masks, gloves, gowns, hand sanitizer, that kind of thing. But it also includes people making good choices. So please protect our healthcare workers so we're able to safely take care of the people. We're a business that can't close. If I closed, we could have a measles epidemic. If I closed, my patients would be going to the hospital. And I also took an oath to take care of my patients. So some businesses can't close. And part of PPE is protecting the healthcare workers that have to do this work with the equipment, but also with teaching people to make good decisions so that we aren't inundated with this virus. Dr. Phelps, I can't hear you.
Dr. Phelps, it looks like you might still be on mute. 1 second. All right, give us 1 second while we try to fix Dr. Phelps's audio. There we go. Dr. Phelps, you should be.
Better. It was in the computer. I don't know how that happened. I'm not a computer expert by a long shot. Sorry about that. Thank you, Dr. Evans, and thank you, Dr. Andrews, for your testimonials and your advice and your pleas. To the audience, our message is really very simple. When Tennessee lowered the curve and initially slowed the spread of the virus, instead of using that time to prepare and address the health crisis, testing and transparent reporting we had to have to break the chain of transmission. Governor Lee rushed to reopen businesses without taking a more cautious approach to protect both our lives and the economy. Governor Lee ignored medical experts and began rushing to reopen on April 27 without a careful plan to contain the virus and protect our healthcare workers. And that has allowed things to get much worse. Now there are more than 430, I think precisely 436 Tennesseans who have lost their lives to this virus. There are over 9,000 active cases today in Tennessee. The solution today is the same solution that we have asked for all along, and we tried, but tried too temporarily. We need to expand rapid contact tracing and isolation of cases. That is fundamental. That's the fundamental of all epidemiology since the beginning. People must be notified that they have this, and they must be notified quickly. And if they've been in contact with someone with COVID, so that they can isolate and protect their own family, their friends, and their neighbors. Of our current cases, how many people have been contact traced and notified? How many others are still going to work, the grocery store, out into the public, potentially infecting many, many more? Until Governor Lee addresses these cases, the cases will continue to rise. Hospitalizations will rise, and ultimately deaths along with it. Thank you for listening to us. Thank you for my esteemed colleagues' time, and I appreciate this opportunity to address this problem.
All right, we have a couple questions on the line, Dr. Phelps. Let's go first to Brett Kelman. Brett, you should be unmuted.
Good afternoon, everyone. First, I just want to say thank you for participating in this call in a field where I know there is some hesitancy to speak publicly, so I appreciate that. I have two questions. One is very narrow and specific, and one is a little bit more broad. First, I would just like to confirm that Dr. Andrews said that one of her patients did pass away from coronavirus. I wanted to make sure that I heard that appropriately. And that second, I just wanted to clarify exactly what you guys are recommending. Are you suggesting that moving forward, Tennessee should progress to open slower than its current pace? Or are you saying that we should actually move backwards a step and reinstate some of the restrictions that have previously been in place and were lifted in late April?
So,
Dr. Andrews?
to your first question, my nurse's father-in-law died of coronavirus. He was 55 years old, had diabetes, too young to die. I have not lost any patients from it yet, and I hope I don't. We're not doing coronavirus testing here because we don't have the equipment to do it. We've had to refer people elsewhere, and it does take a long time to get the results back, to get them back. I actually don't get them. They tell the patient, but they don't tell me. That's another issue. So that was to answer that. And should we move back? Yes, I think we should. I think we should follow the phased reopening recommendations of the epidemiologists. CDC, we were not ready to go to the next phase, and we're seeing the proof of it right now. I think that there might be some kind of a way to change that a bit. I think that the recommendation, definitely the recommendations need to be requirements, because people are not following the recommendations. I'm also the medical director of a free clinic, and it's up in Beersheba Springs, Tennessee, and there was news, and you know, they're just not plugged into what's going on, and a lot of what we've had to do is to explain to people what's happening, and that it is real, and it does kill people. It's killed one person in Grundy County, and there have been 30 cases. But I think people don't understand unless you tell them you have to do this. They don't understand how serious it is. They don't have someone close to them that's died. So yes, I think we need to back up. You know, if we did, we'd be in the same situation that they are in Seattle, where they are gradually reopening safely. But they haven't opened up like we have. It's not time yet. New Zealand shut down, and cases. We need to have the will to do what it takes to get our economy going again, and to protect patients as well, people.
And Dr. Phelps, do you want to add on to that?
Well, what I know is when I go out in public that Tennesseans, I would say most of them, are not wearing masks, are not keeping physical distance safely. And that's sad, because not wearing a mask is basically saying that you really don't care about your neighbor. And this is a republic, and I have to say we've lost that sense of caring about one another's health. And this is America. This is Tennessee. This is the South. We're supposed to care about one another. And unfortunately, this mask issue and social distancing has become it's a political thing now, and that is very disappointing to me. So all we really need to do, Brett, is go back to where we know what works, but we're not doing it. We need the will to do it again. That doesn't necessarily mean close down businesses. I've got children who are trying to run businesses, and I'm sensitive to this. I want normalcy to come back, but we don't know what that normalcy is. To do otherwise is wishful thinking, and that will kill people. We have to look at the facts, and the facts say that the deaths, the active cases, the positive test, all are on an upward trend as we have opened up. And it is cause and effect. We're not following the recommended guidelines, and that results from death. We're all about freedom. Americans have never wanted anybody to tell them what to do. But along with freedom comes responsibility, personal responsibility, community responsibility. We should all know that, but it seems that our society has forgotten that. We need to renew that community feeling and the fact that we need to do certain things. They may be a little inconvenient, but they're extremely important.
Okay, next question is from Stacy Case. Go ahead, Stacy.
Thank you all. If you could just please clarify what it is that you want the state of Tennessee and the leaders of Tennessee to do. I hear one of you say we need to increase contact tracing, and you're not advocating for closing businesses down. I hear others saying we should go backwards and close some down. If you could just please provide a succinct wish list.
Dr. Phelps?
I remember hearing Governor Lee say that he would have a graduated reopening of certain businesses. Some businesses are truly essential, some are not. It started out, in my opinion, fairly well. It was based on some science, it was based on data, and that's what he said, and I think it was. But then we started opening tattoo parlors and barbers, and now also exercise establishments where a lot of danger lurks because you can't keep social distance. You could wear a mask, but you're still at risk because there's touching of a lot of what we call fomites. You touch something, your hand's been to your nose and it's got viruses on it, it transmits it to something else. And so those kinds of businesses where that is necessary to do the business, we're not ready for that because that's probably where it's coming from. And then just playing the numbers. We shouldn't have 30,000 people in the stadium at a sports event yet. We're not there yet. I'd love to go to those events. I love sports, but I can't see that doing that would be safe at this point. And it seems that we're progressing toward that normal and total reopening where things that are not necessary and things that are dangerous are being ignored. And that's just not even common sense. That's not any logic. We need to use logic, but we also need to use the scientific knowledge that we have in medicine to save lives by social distancing, by identifying people who have it so that we can isolate them and keep down transmission. Those seem to be a fairly safe thing, but we really haven't done them or done them well enough. Does that answer your question, Stacy?
Yes, thank you.
Thank you.
All right, last question, it looks like, is Kyle. Go ahead, Kyle.
Hey everyone, it's Kyle Horan from News Channel 5. Can you hear me okay?
Yes.
Yes.
Okay. My question is, you probably saw the governor's press conference yesterday where he was talking about opening up visitations to nursing homes. And so I was just wondering whether or not you thought that was a good idea. It sounds like you don't think that's a good idea, but what is the correct path right here, and what impact will that have on the state?
Having been a medical director at a nursing facility in Lynchburg, Tennessee for 19 years, I'll take that question. We all know that elderly are especially susceptible to this, and susceptible to being to dying because of the coronavirus. It is extraordinarily difficult to keep a virus from, or for isolating people in a facility. There's a reason why this was discovered in early March in Kirkwood Nursing Facility in Washington State. And because people rapidly got sick, one right after another. And I too have a son living about 5 miles from that facility who got it because he was a teacher. I mean, he had COVID-19. He had a tough time of it, but he survived. So did his wife, who is a nurse, and so did my grandchild, who's 2 years old. They all got very ill. So there's something personal in this too. I'm glad that they survived, but older people have much less chance of surviving. There are certainly outliers there. There's somebody who was 96 and went through it and through, I'm sure, very good health care, made it. But then again, there are young people, as Dr. Evans says, who have been affected and sometimes with extremely bad results. So we never really know. And this, again, there is so much we do not know about this novel virus. We still don't know, and we don't have a vaccine. So until we have a vaccine, we've got to make some tough decisions, and we've got to follow those decisions and those tough commands. And one of those things is not being able to see your mom or your dad or your aunt or your grandfather for a while to keep them safe. Every time somebody goes through a door of a nursing home, they could be carrying this to their loved one, and it could be fatal. And so, no, I don't think it's a good idea. After all, nursing facilities are there because, well, there's not enough close family or enough expertise in the family to take care of those people. For instance, I had a patient whose family was I had a patient in Lynchburg whose family was in California. How could they take care of their loved one, you see? And they didn't see them very often, but they stayed in touch by telephone and other means. So I think it's a bad idea. I don't think opening up nursing homes serves any purpose whatsoever.
I have another question. If no one else wants to speak on that, if you want to speak on that, go ahead.
Susan, Dr. Susan Andrews.
Yeah, I have a mother who's 90. She's not in a nursing home, but her first cousin is, and she's not been able to see anyone and didn't even come out of her room until this week since I guess it was mid-March. So, yeah, and I've just thought about how isolating that is and how difficult it is, especially when she's 94 years old and she doesn't have much time left in her life. But I also have a patient who's 69 years old. She's a diabetic. She's a nursing aide in a nursing home. And, you know, she's at high risk. And she could get sick and take it to the nursing home. It's extremely complex. I was also the medical director of the nursing home for 25 years. I don't think it's time. It's not safe yet. There are too many cases out in the community, and unless you're just willing to say that if someone lives in a nursing home or works in a nursing home and is at high risk, that it's okay for them to die, it's not time.
No, I know Dr. Evans also had some comments to make on the last question too. So Dr. Evans, go ahead.
Am I muted?
Nope, we've got you.
Oh, okay. Yes, there's a statistical, it's called the R naught value that epidemiologists call, and it's very complex, but what it measures is how many cases, if a case of COVID, how many cases is it spread to? And so I know other countries are following that, maybe other states are following that. So if the R naught value is less than 1, then it'll be declining. If it's even 1.1, it's going to go up exponentially. So following that is a good way, a cautious way of saying, okay, we can cautiously open. We've opened these and we got away with it. We're okay. Now we can open these. No, we need to go back. So there isn't a good answer to what can we do. We need to be making decisions on a daily, weekly basis. And every community is going to have different data to help inform these decisions. But that's when public health experts come in, and I would say, you know, this is difficult. We have to acknowledge this is very difficult. There are economic hardships, and we need to support our community members that are experiencing economic hardships as a result of this. But I really believe it will become much worse if we don't take care of the public health crisis first. And I didn't mention, you know, nobody's immune to truly nobody's immune to this. We are immune naive population to this pathogen. And children, probably people have read, children are having a very severe, it's called MIS-C, multisystem inflammatory syndrome in children, as a post-viral inflammatory response that can be quite severe, like Kawasaki's disease, which is another probably post-viral response. So we can't be cavalier about this. We have to protect our elderly because they're much more at risk. My mom is 89 and I can't hug her. I visit her on her porch and I go grocery shopping for her, but I can't hug her, and that's how I show I love her right now. We're all in this together, and I just want to reiterate that we need consistent, calm, careful messaging using a cautionary approach from our political leaders that are following the advice of our medical experts, of which I'm not. I mean, I'm talking about the public health experts.
Okay, final question, you guys, if you can still hear me. I was just wondering, what do you believe will happen if Tennessee continues on this current path?
Dr. Phelps?
Well, the predictions are being borne out now, as there is a 42% rise of active cases in the last 21 days. That correlates with opening up of the businesses and economy in Tennessee. And so we see the trajectory just simply going up. As Dr. Millstone has said, he says, this virus won't take a summer vacation. I'm sure he's right about that. What we know in the past is that we've had another pandemic of influenza 100 years ago that killed 50 to 100 million people worldwide. It had bimodal occurrences. In other words, it had a first wave and it killed several thousand, tens of thousands of people. The second wave killed millions of people, 1917, 1918. and that influenza took the lives of a lot of very young people. If this coronavirus, which is a similar virus, but not the influenza virus, but if it does the same thing, then we can look forward to a complete tragedy come November, flu season, because cold season, because coronavirus is kind of a cold virus. Quote, cold virus. It's just a nasty one that kills people about the 7 times the rate of a normal influenza bug. So it doesn't look good if we don't turn back now. You're asking me to be a bit of a medical prophet here, so I'll say that. I'll go out on a limb and say it's going to get a lot worse if we don't start behaving ourselves in an appropriate manner.
All right, with that, we are going to wrap things up. I know the doctors are also actively doing their day jobs too, and appreciate their time hopping on the call. We'll follow up with a video from today and opportunities for one-on-one follow-up with various physicians if folks are interested. Thanks for being on.
Thank you.
Thank you. And thank you, reporters.